Baroness Bennett.
So I rise to move Amendment 4 and speak to the Schedule 1 not stand part, which is consequent on Amendment 4, both of which appear in my name. I will not be speaking to the other amendments in this group, although I will note that I think my understanding of Amendment 5 and 38 to 41 inclusive in the names of the Noble Lords Scriven, Hollands and Browning, effectively are trying to achieve the same thing as I'm achieving, but by different means. But I'll leave them to speak to their amendments, because I do want to explain why I've structured this in this particular way. And I have to begin by thanking Jen Smith at the Bill Office for her great patience and expert assistance to this non-lawyer in producing this and a number of other amendments. And I also want to stress that I'm not, unlike many people taking part in this debate, an expert in this area, but I am seeking to represent voices of people who've reached out to me who may not otherwise be heard in your Lordship's debate in committee. So I want to set out the background to particularly Amendment 4. I had a detailed briefing from the group Liberation, which is a user experience group, people who have experience of mental distress and trauma, that has the slogan "For Full Human Rights." It is seeking a complete end to involuntary detention in psychiatric hospitals and forced treatment for the people it represents, that is, people given mental health diagnoses. They asked me to exclude all people from what's known as detention or sectioning. This group says involuntary detention and forced treatment are forms of disability-based discrimination, and they should not be subject to these. Now, this may not be the case under the European Convention on Human Rights, and I acknowledge the noble lady Baroness Merrin signed a statement to that effect on the face of the bill. But I do understand that it certainly can be argued to be the case under the UN Convention on the Rights of Persons with Disabilities. I also note, however, that the European Parliamentary Assembly has, in line with Articles 12 to 14 of the UNCPRD, strongly endorsed a complete end to involuntary hospitalisation and compulsory treatment, recommending the removing of Article 5(1)(e) from the ECHR, the section that limits right to liberty if people are judged to be, quote, of unsound mind, close quote, describing that particular clause as not compatible with our 21st century understanding of human rights. Now, I note that the recent report from the UNCRPD committee, particularly paragraphs 79 and 80, on the situation in the UK, expresses concern about the lack of government measures to end disability-based detention, and about the fact that the then Conservative Mental Health Bill continued to allow involuntary detention and forced treatment. Now, the bill that we have brought before us today by the Labor government still has the same kind of provisions. Now, the argument is that this bill, as it stands now, remains non-compliant with the UNCRPD, the institutionalisation guidelines, and also with the World Health Organisation publication Mental Health, Human Rights and Legislation, Guidance and Practice, in which countries are urged to replace institutions with high-quality services. Now, I can almost feel your Lordship's House saying, how can that be possible? Starting from where we are now, that looks like such a long way away. And that was indeed the question that I put to Liberty. And they presented me with a number of case studies from around the world. And I imagine the noble lady, the Minister, is aware of the case of Trieste in northeastern Italy, which has almost managed to abolish involuntary detentions. And they've been replaced instead by a wide-ranging and accessible community services based on a whole-person approach. They have community mental health centres that are open 24 hours a day, 7 days a week, and they play a key role in preventing people from reaching a point of crisis. They have enabled people with mental health diagnoses to remain in and be part of their local community, in line with Article 19 of the UN Convention. Now, compulsory psychiatric treatment orders are still possible, but the numbers are very low and the orders typically last 7 to 10 days. In Spain, there's Act 8/2021, which recognises the legal capacity of all adults, stipulating that disabled people should receive the same legal treatment as non-disabled people, including those with mental health diagnoses and people with learning disabilities. Still not complete equality, but heading that way further than we are. Costa Rica, Peru and Colombia have all taken steps in this direction. In Peru, for example, a recent study on the impacts of crisis interventions indicate that involuntary detention rates have been very significantly reduced, and when people are detained, they typically leave hospital after a couple of days. In Mexico, there's the General Health Law of 2022, a national civil procedure code that says everybody has legal capacity, including people with mental health diagnoses. It enables access to supported decision-making for everybody. And Mexico City in particular has set a real lead in delivering on this. I would acknowledge that not all of Mexico has. So, why have I simply put down an amendment that would effectively end detention for those with autism and learning difficulties? Well, I feel like I have to apologise to the people I've spoken to that I didn't feel able to put down an amendment, even though this is perhaps by nature of a probing amendment. I looked at the realistic situation. The Noble Lady Baroness Tyler, in starting our debate today, referred to the extreme lack of resources. I and many others have amendments later in the bill referring to the need for the bill to specify the level of resources. And so I'm really sorry that I did not feel able, even in this probing stage of committee, to put down that amendment. I would like to, and I would very much welcome the Noble Lady the Minister's comments on how we sit in that UN framework, whether the government indeed has a long-term goal to reach the kind of levels that many other countries, an increasing number of other countries, have attained, as I've just set out in the quick survey. But I do have to look at the reality of the statistics, and I look at the figures in the briefing from the Royal College of Psychiatrists, and the number of recorded detentions in 23-24 is 52,500. And I think we really have to reflect on that number. But of those, we've actually seen a fall in the level of detentions relating to learning disability and autism to 1,880. So it seems to me that this would be a step in the right direction. And we are talking about disabilities. And can we really continue a quarter of the way into the 21st century to detain people for their disability rather than provide them with the support that they need in the community? That's a question that this amendment is seeking to raise. I do also want to reflect on the fact that we will, I'm sure, again and again come back to the fact that people are not getting the help they need, and that's leading to the state of crisis that we have now. I note Mind's briefing here that people are crying out for help and not getting it. In June 2024, very urgent referrals to crisis teams for adults were 45% higher than a year before. And I feel like I should also here declare my position as Vice President of the Local Government Association and refer to the LGA briefing, which talks about the significant resource implications for councils, even of what the bill does now as it stands, as presented by the government. So, my Lords, there are voices here, I believe, that should be heard. I believe we should frame this in the context of the international situation, of the UN Declaration on Human Rights of persons with disabilities. And that's why I've tabled this amendment, and I hope that we can have a constructive discussion and see some real progress here today. I beg to move.